Let's get some analysis from Tom Bossert, who served as White House Homeland Security Advisor to 2 presidents and led the development of our country's pandemic response plan. It's great to see you this morning, Tom. You were a leading voice in trying to tell people about the risks of COVID and what went wrong in the last response. Here we are again. You heard Dr. Murthy. What's your take on this?
Martha, you know, not only are we here again, but before we talk about all the things that went wrong, I'm struck by how much went right. A lot of people in this country have contributed and played their role, not just public health officials and public health care officials like Dr. Murthy, but average Americans who are all masking and social distancing. And think how much worse it would be if we had let all 1 million deaths, and I think we will approach 1 million deaths here, to take place all in 1 year or one period of time. We've spread it over 2 years, which was part of the original goal, and we've developed a vaccine. And without 9 billion doses of that vaccine delivered, we'd have a lot worse of a problem. But frankly, I wouldn't be here if things were going well. And I was understanding, but a little disappointed in what I heard from Dr. Murthy. Essentially, in order to maintain trust, he needs to acknowledge some failure here. We've ordered too few testing kits, so our testing capacity has continued to lag behind each wave. It's too little and too late, but noteworthy for the next wave. We've ordered too few and too little treatments, and we don't have yet a global distribution and delivery plan for vaccines. So there's a lot that we can work on, as he acknowledged. But for right now, Americans that are frustrated and giving up, I think they need to hear that a return to some rigor in our social distancing is necessary, because our hospital beds, and more importantly, our hospital ICU beds, are filling up, and in some states are completely full.
And messaging and public trust is so important in this, and the messaging has been confusing.
The federal government really has 2 big primary roles. The first is procuring these vaccines and treatments, and we've made some significant mistakes there and failed to make big bets. The doctor mentioned that we've got another Merck drug that we've ordered, but they ordered that one early in the test trial phase. That's what they should have done with Paxlovid. They waited 6 months for 2nd and 3rd phase trials, and they shouldn't have done that. And so now the messaging breaks that public trust. Admit that, and I think they'd earn some trust, and we'd be able to move forward. If we change our messaging, vacillate on our belief set, lose sight of our common purpose or goal, people pick up on that and they don't trust anymore. So, in fact, I tell people that in a crisis, which is what this is, clear and consistent messaging, telling people what you know and don't know, and acknowledging mistakes and moving on are the 3 keys to maintaining trust. And if you break any one of them, you'll have a harder time with the underlying core response plan and its execution.
Always great to have your analysis. Thanks so much, Tom Bossert.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.